we here at Questions from Quarantine know you have heard a phrase a lot lately, and that phrase is contact tracing. Not a lot of us know what contact tracing is or how it works, and luckily we have our very own doctor and expert to explain it to us. Dr. Margaret Bourdeaux, would you mind giving us a quick primer?
Quick primer on my favorite subject. Okay, so contact tracing is one of three basic public health strategies to confront COVID, okay? So the other two are things like social distancing, general public measures. People wear a mask, they hand wash. That all is sort of a general public strategy. Another one would be development of medicines and vaccines that either make people less sick or, or able to prevent the spread. So those are two other strategies. Contact tracing is its own strategy, and it has basically four components, okay? And they're all interrelated, and if one component doesn't work, the whole thing falls apart. So the first step in contact tracing is being able to identify sick people, who's infected with a virus and who is infectious, who has it and can transmit it, okay? And that's case finding, and that's the part we're really struggling with, where we really need more tests, and we need to deploy testing in a strategic way. So case finding. Then once you find those cases, you do something called contact localizing or contact identification, where you see all the folks that a sick person has been in contact with, and then you find them, you reach out to them, and you assess whether they are sick or not. Okay, so then there's plank 3, and the third plank is for the folks that are not sick, they need to go into quarantine, okay? And they need to go into quarantine for a period of time until you can see whether they either become sick and you can quickly make sure they don't spread it to anybody else, or they don't get sick and then they can resume normal life. Quarantine policy is asking people to stay indoors away from others for 14 days. And so in order to execute on that successfully, people need a lot of support. Okay, that's very hard for people to pull off. They need groceries, they need salary support, they need childcare, they need all sorts of things. So the third plank is supported quarantine. Then for the folks that are sick, then they need to do something called isolation, which is similar to quarantine in that they stay away from everybody, but there's an additional piece, which is that they need to be monitored medically to see if they need medical support. Also, obviously, if you're infectious, then it may be very, very hard to keep your family from getting the disease if you're living in close quarters. So sometimes, there's a suggestion and discussion about whether we should offer people a non-home-based isolation facilities where they can get medical care and they can get support, but they're not at risk to other members of their household. So 4 planks: case finding, contact localization, supported quarantine, supported isolation. We have to have all 4. It doesn't work.
Yeah, I mean, I hear that, and this is the challenge that we're in right now as we head into the summer, and whether we're in, are we in the wave 1, wave 2? Let me just make it clear. We're in wave 1, 25 plus states right now, late June, early July, are showing upswings, the first upswing. And it's not just related to increased testing. So what's likely to happen is we will be fighting one, then not being able to build up the kind of capacity that Margaret's talking about because of various, the country not paying attention, each state having its own rules, each corporation having its own rules, each community having its own rules. And then we could see what most medical professionals you would view as a not likely, but it's new. We don't know what's going to happen. Potentially a second wave sometime in October mixed in with the flu season. So when you see the bell curve like of the EU, and they're now plummeting, right? Why is that good? That's good because it's saving lives. It's also building capacity. It gives them time to build capacity for testing and tracing and all sorts of other things, so that when the second wave comes, if it does, it's not going to have the same impact. We won't have that gap in time and gap in planning.
Thank you so much, both of you. That was a very wonderful primer and excellent explainer. Hopefully you understand contact tracing a bit better now. If you have any future questions for us, you can always hashtag Questions from Quarantine on Twitter or any other social media. Thank you.